Thanks everyone for joining. We have today with us Dr. Amit Malik. He is the founder of InnerHour, and he's a psychiatrist who's practiced both in India and the UK for over 15 years. It's a privilege, Amit, to have you here speaking about mental health, technology that's disrupting the mental health curative landscape, as well as your experience in kind of delivering some of these services to the broader ecosystem. So really look forward to this conversation.
Thanks for having me, Siddharth. Really appreciate both you and Deloitte taking the lead on this one. So in the last couple of years of my stint in the UK, I worked with a number of tech-enabled mental health platforms, right? Largely as partners for our organization. And I saw the impact in a range of parameters, right? Whether it was engagement, whether it was early access, whether it was outcomes, that some of these organizations were having and deliver at a population level and in relation to dollar spent. Right? So it really felt that for an ecosystem like India, which was A, very spread out, B, very diverse, and C, the investment was still at a relatively lower level, tech could play a large and important part in driving success and delivery from that perspective. The trust on the platform is and not just a platform, but the trust with your professional and your therapeutic is a critical driving factor in the success of the outcomes. The moment that trust is not there and you're worried about what you can and can't talk about, that is when it's actually a pointless exercise on all sides from that perspective. So we are very clear that we don't, we about your data and how we use it. We have very clear policies around it. And we've turned down lucrative monetization opportunities in the past to make sure that we don't compromise that principle in any way. We've seen so much of it, and we've seen huge differences based on 2 or 3 parameters, right? One is leadership buy-in and leadership modeling of behavior. Right? Without going into specific names of organizations, we worked with this really small 200 people team very early on in our journey, and where there was where the leadership from the founders down, but totally bought into the idea of mental health to the extent that they used to come and openly talk within our workshops. One of the founders would come in and take therapy himself when we were doing therapy on site for them, which is what they wanted, in addition to what we were offering them already. And we saw insane amount of uptake within the organization, right? So how do you talk about this within the organization? What the narrative is? Right. And secondly, then how do you model that behavior as a leader or leadership team within the organization has huge impact on how the rest of the organization not just perceives the value of the service, but also feels comfortable exposing themselves in that way. I think the first thing to say is this is happening, right? I mean, regardless of there are enough tailwinds now, then this is happening. And the reason I'm saying that is that it's not sustainable in an economy and an ecosystem where you have 1/6 to 1/7 of the economy with significant mental health difficulty. And this is not me having a bad day or me not feeling great for a couple of days. This is real significant mental health difficulties, right? And the impact of that on psychosocial milieu, your life, personal, professional, is so huge that we've been able to hide away from it because as an economy, that's where we go, right? As the value of individuals rises in this economy, which is dramatically, and it has risen again in the last 2 years dramatically, right? And their self-worth and their worth to their ecosystem, their families, the economy rises, which it really is, then people will seek out the support, which is happening already, right? What will help is open conversations.